Good evening. I'm Joe Obahowitz, Fund Director here at the Eastern Atlantic States Carpenters Benefit Funds. Welcome to the webinar series tonight on retirement awareness. This is phase one. So whether you're an apprentice or a journeyman, it's very important to understand your benefits, especially as you get closer to retirement. Tonight, we're going to talk about your healthcare coverage, whether or not you're active or retired, and how you qualify for coverage in your retirement. We're also going to touch upon your pension, how it's calculated, and the different payment options, and how they factor into your retirement income when it's that time. We're also going to discuss pre- and post-retirement death benefits. And last but not least, we're going to talk about the annuity plans and what kind of payment options you have when it's time to retire. At the very end, as Hallie mentioned in her presentation, we'll do a live Q&A. We'll have the panel and the presenters back up here and answer your questions. So feel free to start sending your questions now or wait until the end. With that being said, retirement planning is key. Retirement is not just about numbers. There is a bigger picture involved here. And one is being financial security. You want to ask yourself, why are you retiring? Do you know your numbers? Do you know your pension numbers? Do you know your annuity numbers and how that's going to factor in? What kind of debt or savings do you have? Then we move on to desired lifestyle. What kind of desired lifestyle are you looking to have in retirement? Do you want to explore your old hobbies, new hobbies? Are you going to travel? Are you going to continue to working? Again, all questions to ask yourself. Also very important is your well-being. Are you healthy enough to retire? Prioritizing your health, exercising, and eating right. You're going to have a lot of times on your hand. Are you retiring with healthcare coverage? If you are, great. If you're not, what's your plan? And last but not least, the mental health aspect and the life transition. You know, the challenge of losing that daily structure. You know, losing also that secure and steady job that you've been at for 25 to 30 years, and losing that interaction with friends and colleagues that you were used to every day. And last but not least is time management. I have some friends and family that are lucky enough to be retired. And when I ask them how retirement is, they always mention that every day feels like a Saturday. I hope to get there one day. But the one thing that they never say is that they should have never retired. But planning is key. Quick housekeeping item. For those that do not know, or hopefully know by now, we did mail out a letter in January to let you know that effective January 1st, 2026, there was a merger of pension plans to where the Greater Pennsylvania Carpenters Pension Fund, which is the Pittsburgh and West Virginia area, the Mid-Atlantic Regional Council of Carpenters Pension Fund, which is DC, Baltimore, and Maryland, and the Carpenters Local 491 Pension Plan, which is a small trade show group in Baltimore, merged into our fund, the Eastern Atlantic States Carpenters Pension Fund, effective January 1st, 2026. Another change that happened due to the merger was the elimination of the variable pension plan design adjustment component. And what does that mean? That means for any contributions or hours worked after January 1st, 2026 will no longer be subject to the VPP adjustment every year. You might be asking yourself, how's that going to impact you? Reno Randall, one of our presenters and retirement specialists here at the fund, will make sure he touches upon that during his presentation. With that being said, I'm going to turn it over to Heather Hatch, our medical department supervisor, to give you an overview of the health plans. Heather?
Thank you, Joe. Good evening, everyone, and thank you for joining us here tonight. My name is Heather Hatch, and I'm the medical department supervisor here at the fund office. Tonight, we're going to go over what your coverage currently looks like, so your active coverage, and then we'll touch base on your retiree coverage and what happens when you become Medicare eligible. So your active coverage. This is the coverage that you should be pretty familiar with. The fund offers two different benefit levels. We have the gold and the silver. If you work the required amount of hours for the gold level benefits, you will receive independence administrators for your major medical, Cigna benefits for your dental, Davis Vision for your vision benefits, and prescription benefits will be administered by Express Scripts. For silver level, you will still receive independence administrators. However, you will lose dental and vision. You still will receive Express Scripts for your prescription coverage. Two important things to notate here: that the medical plan year does run from April 1st through March 31st. And please make sure you log onto the fund's website and you check your hours periodically to make sure you're hitting those hour requirements to obtain medical coverage. Your prescription benefits are administered by Express Scripts. Here on the screen, you see the current copay structure. If you happen to get to the pharmacy and you are receiving a 30-day supply or a 90-day, and the pharmacy tells you that you're either going to be paying more than $75 or more than $150, please call us here at the fund office. Most likely you're on a non-preferred medication. Fund staff can look into the system and see if there are any alternative medications that may be suitable for you that you can talk to your doctor about. Also, for your specialty medications, we do have a Credo Specialty Pharmacy. They do have a program with Save On that will bring those high-cost medications down to little or no cost to you. Mental health benefits are administered by mental health consultants. The mental health benefit is very important to us here at the fund office. Mental health and independence administrators do share an out-of-pocket maximum for the plan year. However, it's very important to notate that mental health consultants does have a different provider network. So if you are in need of services, please make sure you are in contact with MHC to make sure your provider is in network. We also partner with Manifesto Health. Manifesto Health has recovery support services that are available to you 24/7 at no cost. They're available either via phone or telemed. So you just worked your entire career. Who wants to spend their post-retirement days at the doctor's office? The fund office offers a variety of benefits that are no cost to you. The two I want to point out here on the screen are the Gallery and the Catapult Health Kit. Gallery is a multi-cancer early detection test kit where a licensed phlebotomist will come out to your home on your time, take a small sample of blood, and we'll have that blood sampled for over 50 different cancer markers. The Catapult Health Kit is basically a physical in a box. Once you request your kit and you receive it, follow the simple instructions, return it, and a licensed nurse will contact you with all your results. Please note that all these benefits listed here on the screen are for active and early retirees. Once you become Medicare eligible, you are no longer eligible for these benefits. However, please visit the fund's website for additional benefits that you may be available to you. The fund office also does offer a disability and a workers' comp benefit. If you happen to be injured on or off the job, or you have an illness that prohibits you from returning to work for a short period of time, please contact us here and request an application. Both benefits, if you are eligible for, you will receive 30 hours a week of credited health hours and pension hours. You're eligible to be on the benefit for up to 2 years. If you are approved for the fund's disability benefit, you will receive a stipend of $550 a week. You will have to subtract any amount for taxes and any amount that you receive from the New Jersey State Disability. The fund also does offer 2 death benefits, one for the active member and one if an eligible dependent of an active member passes away. In the event you, the member, pass away prior to your retirement, your designated beneficiary will receive a $35,000 death benefit. If your eligible dependent passes away while you're actively working, you will receive a $5,000 death benefit. Please make sure you notate that these are death benefits. These are not life insurance policies. In August of last year, the fund office mailed out over 20,000 beneficiary forms. If you have not received this form, please make sure you contact us here at the fund office to request a copy. It's very important that you keep these up to date as much as possible. If you have returned your form already and have logged onto the fund's website and you don't see that your beneficiary is updated, don't panic. We most likely have it. Give us a call here. Fund staff can look through all the scanned copies and verify that we do have it on file. For all the active benefits that I just went over, you can visit the fund's website for additional information, including downloading a copy of our Health Fund Active SPD. If you would like a physical copy, please contact the fund staff and we can mail you one out. Now let's go over our retiree coverage. How do I retire with healthcare coverage? In order to retire with healthcare coverage, you must be eligible in the benefit period you wish to retire in and the one immediately prior. And you also have to have the required amount of active health plan credits. So how many health credits do I need? In order to retire with healthcare coverage that mirrors the gold coverage that we have now, you will need 30 credits. For each gold level benefit period you have earned during your career, you will receive a half a credit. For each silver benefit period that you have earned, you will receive a quarter of a credit. The most, you can only have one credit in one plan year. So I've retired with healthcare coverage. What happens next? Once you retire, we will transition you and your eligible dependents into what we call our runout period. This is the time frame in which you will not have to pay for your healthcare coverage. So, for example, you want to retire June 1st. You will be entitled to the remainder of that benefit period plus an additional year. So you will have from June 1st through September 30th, and then October 1st through March 31st. You will not have to pay for benefits for you and your eligible dependents until April 1st of 2027. What happens if I retire, but I'm not eligible for retiree healthcare coverage? You will still receive a runout period. However, you will only receive it for the remainder of that benefit period. So same example, you want to retire for June 1st of 2026. Your coverage will run until September 30th of 2026. As of October 1st, you will be offered the fund's COBRA plan, which you and your eligible dependents will be entitled to for 18 months. Unfortunately, when that time period is over, you will have to find coverage somewhere else. One option we like to give is you can visit the health insurance marketplace for coverage after that COBRA benefit period. The biggest question we get here at the fund office is what happens to my HRA after I retire? Once you retire, that balance will roll over. As long as there is activity on the card for no less than 3 years, so you're constantly using it, whether you're at the doctor's office, at the pharmacy, that money just continuously rolls over. You can also use this to be reimbursed for your retiree monthly premium. So you're about to turn 65, you're retired, you're enjoying your retirement life. What happens to our coverage now? The fund offers a Blue Medicare Advantage plan for our Medicare participants, as well as a Part D plan through Express Scripts. Prior to your 65th birthday, you're going to receive a ton of mail from all different plans. The only mail you need to worry about is anything that comes directly from Social Security and here at the fund office. We will give you the benefits that you need. It's very important that you remember that you enroll in Parts A and Part B, and as soon as you receive that card, you give us a call so we can have a copy of that. In the event after you retire, you are to pass, your eligible family members will still be covered for a certain amount of time. Your spouse and your eligible dependents will be eligible for 12 months after the date of your death at the current premium that they're paying. After that time frame, your surviving spouse will be eligible to enroll in our surviving spouse benefit, at which they will pay the applicable COBRA rate for the remainder of their life if they wish to continue benefits with us. Your eligible dependents, however, will still have that 12-month time frame, but once that time frame is over, they will be eligible to enroll in the fund's COBRA benefits for up to 36 months. For more information about all retiree health benefits, you can visit the fund's website. You can also download a copy of the Health Fund Retiree SPD. And once again, if you would like a physical copy of this, please contact us here at the fund office and we can mail you out a copy. This concludes the medical portion of our seminar. I will now hand it over to Reno Randall, who will go over all of your benefits for pension and annuity.
Excellent. Thank you, Heather. Good evening, everybody. My name is Reno Randall. I'm one of the few retirement specialists here at the Eastern Atlantic States Carpenters Benefit Funds office. Tonight, we're going to go into what you can expect when you come to retire. So let's jump right in. There are two parts that we are going to discuss tonight. The first part is the pension fund. Second part is the annuity fund. We're going to start with our pension fund first. So as far as the pension plan, retirement is always the first of every single month. So when you do decide exactly when you do want to retire, give us a call 2 months prior to that retirement date. If you are a divorced member with a quadro, give us a call 4 months prior to that date. So the Eastern Atlantic States Carpenters Pension Plan is a defined benefit plan. This plan, we're specifically looking at hours between January 1st through December 31st. That is the pension plan year. Please do not confuse those dates with anything that Heather just discussed. Specifically, pension hours and contributions are looked at between January 1st through December 31st. So this defined benefit pension plan does make up the jurisdictions of New Jersey, Pennsylvania, Delaware, Maryland, Virginia, and West Virginia. So as far as the pension plan, it is made up of 3 separate parts. When you come to retire, there will be one final payment when you do retire. But when you do request a pension statement, or when you are looking into your actual pension application, it will be broken down into these 3 separate pension parts. The first part is your legacy pension plan. This is a frozen plan, so that there are no more contributions going into this plan, and it does not change depending on any variable pension rates or any performance of any plan investments. The second part is our variable pension plan. This variable pension plan does change on the performance of the plan, and it does change while you're actively working or after you retire. It does continuously change. This plan ended as of December 31st of 2025. And then this brings us to our third part. This is our current pension plan. This one started January 1st of 2026. And this plan is a benefit bearing account, and you are subject to get 1% of the contributions that you get. So let's kind of dive into more of what and how makes up that current pension plan. So based on the amount of hours that you are working in that plan year, again, January 1st through December 31st, based on the amount of hours that you are working, your employer is going to pay in contributions here to the fund's office based on those hours. Those contributions are different depending on the actual jurisdiction you are in, but once those hours and contributions are paid into us here at the fund's office, you as a member will get 1% of those contributions, and then that is going to make up your actual pension accrual rate for that plan year. So then that will be added to any former legacy accounts that you had or any former variable pension amounts that you had. So an example we have here in the year of 2025, let's say you have $20,000 of contributions that come in during that plan year. You would get 1% of those contributions, which would then equal out to $200 of a pension accrual rate. And that's what you would have made up for your 2025 pension amount. And that adds to your monthly payment amount for your pension. So how can you get entitled to your actual pension amount? You do have to be a vested participant. To become vested in the plan, you must work at least 5 plan years. To get 1 pension credit, you need to work 800 hours or more. That gives you 1 pension credit. Then once you do that 5 times, you do become a vested participant. If you're a former Philadelphia participant, you are grandfathered into that plan where you only need 3 years to become a vested participant. Once you work 800 hours or more and you get your first pension credit, you do become active. You must get to that active status. Once you're there, you actually can get pension partial credits. So as you can see here on this chart, it does make up actual credits. If you do not hit a full 800 hours after you are active, you can get a quarter credit, a half a credit, 3/4 of a credit, or that full pension credit if you work 800 hours or more. Please note, if you do work well more than 800 hours, you cannot get more than 1 full pension credit. The most you can get within 1 plan year is that 1 pension credit. Also note, as you can see here, you do not get a credit if you work less than 200 hours within a plan year. If you do work less than that 200 hours, you do become inactive the following plan year, and that is considered a break in service. If you are not a vested participant and you have a break in service for 5 consecutive years, you are subject to forfeit all pension contributions and hours that have came in throughout your career. So it's very, very important. We cannot stress this enough. It's very important to remain active, keep getting your pension credits, and become a vested participant to be entitled to that pension amount. Okay, so the reason of why we're all here, right? It's a retiree seminar. When can you retire? To retire with normal retirement eligibility, you must be at least 65 years old with 5 pension credits. To retire with early eligibility, you can be at years 55 years old, but you need a minimum of 10 pension credits. That is subject to a reduction, but if you retire age 55 with 30 years or more, you do get an unreduced early retirement. And we'll kind of dive into what that percentage reduction is on the next slide. For any former Philadelphia participants, you can retire at the earliest age of 52, but you need at least a minimum of 33 pension credits. It's considered the rule of 85. I'm sure some of you have heard of that before. You do get that as a former Philadelphia participant to retire before age 55, but your age and years of service have to add up to 85. Kind of piggybacking on the rest of that rule of 85, for any former Philadelphia participants, if you are eligible to retire with that rule of 85 before January 1st of 2033, you are eligible to receive your post and pre-merger accrual benefits, all unreduced. However, if you are not eligible to retire before January 1st of 2033 under those rule of 85 years, then you can still get your pre-merger accruals all unreduced, but any post-merger accruals, so this starts with your variable pension plan and so forth, that is subject to a reduction depending on the age when you retire, leading up to age 62. That is a 3% reduction every year between the difference of when you retire up to age 62. So if you retire age 52, that is a 10-year age gap between 62 and 52. That is a 30% reduction that you would take on all post-merger accrual rates. As far as the pre-merger accruals, any old plan rules, those are grandfathered, so any old plan rules will follow that old plan. For any former Philadelphia participants, you are subject and you can get the supplement benefit if you are eligible and you meet the actual requirements. If you have any question with what those requirements are, please give us a call at the funds office. And finally, the last type of retirement that we offer is a disability retirement. So this disability retirement, the first step is you must have Social Security disability, total and permanent disability. Therefore, you must have a Social Security disability letter with an actual onset date of that disability. If you do have this and applies to you directly, give us a call. We'll go through any other requirements that is needed for a disability retirement. Okay, so that makes up exactly how you can retire. So what can you expect when you finally do retire as far as what payment options are available to you? I do want to make a point of emphasis here. If you are a divorce participant, any divorce decree, property settlement information, or quadro, which is a qualified domestic relations order, you must send this all to us here at the funds office because we need all of that information here prior to your retirement. Okay, so let's jump into our payment options. I do want to say one thing here with the payment options. Once you choose what option you want when you retire, you can never change this payment option after that. So it's very important to come in very prepared, understanding exactly what you're looking at when you go to retire, because that option can never change. So first, we have joint and survivor options. These are specifically for our married participants when you come to retire. If you are a single participant, we're going to cover exactly what you can choose at the next slide, but this is specifically for our married participants only. So you can see there are 3 options here. You have the 50%, 75%, or 100% joint survivor option. These are all reduced amounts depending on your full pension accrual rate, with 50% joint survivor being the least amount that is reduced. And then 100% joint survivor is the most reduced joint survivor option. If you are a married participant, your default option is the 50% joint survivor if you're younger than age 65. This amount, basically what that means, if you choose the 50% joint survivor option, that when you pass away, your spouse would get 50% of the pension benefit that you choose, and she would get that as a lifetime pension for herself. And then that kind of follows for the next one, the 75% joint survivor options. Your spouse would get 75% of your pension benefit, and then 100%, your spouse would get 100% of that pension benefit. If you retire at normal retirement age, again, 65 years or older, your new default then becomes the 100% joint survivor option, because any reduction is then taken away and you get your full pension accrual rate with the 100% joint survivor option. I want to note here that if you do choose one of these three options, where therefore you are taking a reduction on your pension amount, if your spouse predeceases you, you are eligible for a pop-up. And what this means is that your pension benefit will eliminate any reduction that you were taking for that lifetime benefit, and you'll get your full pension accrual rate. So if this does happen to you, give us a call at the funds office and we'll update that. Next, we have our payment guarantee options. These are available to our single participants or our married participants. The 60-month payment guarantee or the 120-month payment guarantee, the biggest questions we get with these two options are, do I only get these pension options for that amount of time? No. If you choose these two options, they are lifetime pension guarantees. The payment guarantees are specifically for your beneficiaries. So what this means, if you choose the 60-month payment guarantee, you are guaranteed to receive no less than 60 payments. So if you choose this option and you only get 30 payments and then you pass away, there would be 30 payments left on that payment guarantee, and whatever is left would be multiplied by the amount of pension accrual that you are getting, and that would be paid out to a beneficiary that we have here on file. The 60-month guarantee, that is the default option if you are a single participant. If you do choose one of these two options and you are married, your spouse is going to have to sign a waiver at the time of retirement. Okay, so that makes up our actual pension options that are going to be available to you when you do retire. Now we're going to jump into our death benefits that are offered. Again, this is something no one wants to discuss, but it's very important that we offer this death benefit. And please remember, this is not a life insurance policy. It's a specific death benefit option. So if you do pass away before you retire, there are some pension benefits here that are going to be passed down. So if you are a single participant and you are vested and active at the time of your passing, the amount that you have made up for your pension accrual would be multiplied by 60 times, and that would be passed down to your beneficiary here that we have on file. This is another very important reason why it's important to update your beneficiary, make sure that form is completed, and please make sure you are viewing that and getting that updated to us. If you are a married participant and you do pass away as an active invested participant and you are married for at least 1 year, but you pass away prior to age 65, your spouse would then get 50% of your pension accrual rate, and then she would be into that 120 payment guarantee option, what we just discussed on those previous payment option slides. If you pass away as an active participant and you are age 65 or older, your spouse would therefore get 100% of your pension option. She would not be entitled to any payment guarantee. She would just get that 100% pension accrual rate for the rest of her life. Okay, so what can you expect after you retire? We do have a death benefit offered here to our retirements if you are eligible for that. To be eligible for that, you must retire with normal retirement, early retirement, or a disability retirement. If you qualify for that, you are entitled to our $10,000 death benefit, and that's going to be added onto any joint survivor options or any payment guarantees that you choose at the date of retirement. So that covers our pension plan here. Next, we're going to get into our annuity plan. So the Eastern Atlantic States Annuity Plan, it is a defined contribution plan that does have a plan year of January 1st through December 31st. This has the exact plan year as our pension plan, again, January 1st through December 31st. This is a plan that does require and go off of our investment earnings. These investments are all trustee directed. You can view exactly where these allocations are being, where they're going and being allocated to. If you log on to our carpenters.fund website, go under the annuity fund tab. Under there, you can go to the allocation of our annuity funds. And you can see exactly where our trustees have those annuities going. And finally, unlike the pension plan in this aspect, you do not need 5 years of vesting status. Once you get your first dollar in that amount, you are vested to it and you're entitled to that amount. So what makes up our actual plan calculation for your annuity plan? So you start with your beginning balance, and then if you have any payouts, that is subtracted from your balance. Then there is also a $10 admin fee that is taken out every month. Then that is multiplied by your investment earnings. Your investment earnings, it is a year-to-date earnings investment. So essentially, we are looking at how much you have in your balance at the end of every plan year, and then that is going to incur any plan investments. Basically, these investments are applied around April or May of every year. If you have any questions about that, give us a call at the funds office and we'll be able to answer that for you. And then any contributions that you have that come in during a plan year are then added on top of that balance. So you're putting all these contributions and hours into this amount. How are you eligible to withdraw these funds? So there are a few criteria. The first one is retirement or when you pass away, that would make you eligible for a withdrawal. Next is total and permanent disability. If you have that Social Security disability letter, that does make you eligible. Next is a separation of service. If you go 12 consecutive months without working within the construction industry, you can withdraw. Next, we do have an in-service withdrawal. This is for our members who are at least 59 and a half years of age with at least 20 pension credits, you can withdraw. Next is our hardship withdrawal. I'll go through in the next slide exactly what makes you eligible. And finally, these are for our quadro participants. If you have a qualified domestic relations order, that will make you eligible to withdraw. So once you're eligible, what can you expect with these payment options? So the first one I'm going to discuss is the lump sum option. You can do a full lump sum or a partial lump sum out of this account that is subject to a 20% mandatory federal income tax. If you retire if you withdraw prior to 59 and a half, that can also be subject to an additional 10% penalty. Next, you can roll over. So if you want to avoid any of those tax breakdowns, you can roll it over into a qualified plan or a traditional IRA account to avoid that 20% mandatory tax. Next, we do have monthly installment payments. These go out the first Friday of every month, and the minimum amount you can choose is $100, and that goes up in $100 increments. And then finally, if you are not and you're unsure exactly what you want to do with these balances when you do come in to retire, you can leave them here. And then once you do realize and know exactly what you want to do with those funds, contact us. We'll send you an application, and then you can withdraw those funds. Okay, so what makes you eligible for a hardship? So to be eligible for a hardship, you must have medical expenses that exceed over $1,000. If that's so, give us a call. We can understand and see if you qualify. Next, if you purchase a primary residence or if you are being evicted from a primary residence can qualify you. Any education fees post-high school education with an accredited service tied to it can qualify you. Home improvements due to catastrophic life events such as tornado or a hurricane. And finally, any funeral expenses due to an eligible dependent can qualify you. So finally, if you do qualify for one of these hardship rules, there are some actual rules that we have to follow here. The first one is you cannot withdraw more than the hardship is requesting. Next, you cannot withdraw more than $50,000 from your account or half of your account balance, whichever one comes first. You cannot have a withdrawal within a 12-month period. So if you have a withdrawal, you must wait a minimum of another 12 months to do the next one. And then finally, if you do not have $2,000 in this account, you are not eligible. So this leads us to our final slide here with the annuity plan. If you are a former Philadelphia participant, you potentially could have a legacy A and B account. This legacy A and B account is frozen, so there are no more contributions that are going into it, but it does earn interest off the 30-year Treasury bond rate. So it does gain interest over time. With this account, you do have to make an election when you do come in to retire. So you can't just leave them here. So make sure you know exactly what you're doing with them when you come in to retire. And then next, for any former New Jersey participants, you may have a money purchase account. This is contributions prior to 2009. This does follow some of the same rules as that profit sharing annuity account we just discussed. So this does gain interest over time, and you can leave that here when you go to retire. Okay, so that makes up our pension plan and annuity plan, everyone. So again, thank you for listening. I'm going to pass this to Joe Obahowitz for any closing remarks. Thank you, everyone.
Thank you, Reno. As I mentioned in the very beginning, retirement planning is key. As you can see, there's a lot of information regarding your benefits, especially as you're coming up to retirement. Just a couple key takeaways before we start our question and answer session is understanding retirement and the importance of planning. We're going to keep hammering that over and over again. Also, know your healthcare coverage and what your expected cost may be, whether or not you're active or retired. Understanding the Medicare plan and how that may fall into your healthcare needs in retirement. Taking care of yourself. I know a part of Heather's presentation was talking about preventative services that are offered either with little or no cost at all. So make sure you're taking advantage of them. Some of them can and have been life-saving. Obviously, the importance of optimizing your retirement benefits through your pension annuity plan, picking what the best payment options for you. And the next steps, what are the next steps? Very importantly, we're going to be running a phase 2 of our retirement awareness series about financial awareness, where we're going to have 2 qualified personal financial planners at the fund. And that's going to be next Wednesday, February the 18th, same time at 5:30. Again, we're going to do a live Q&A with the financial planners. Full disclosure, the financial planners are not affiliated with the fund. They don't manage any of the fund's money. They're here just for educational purposes only, but they come from reputable companies. So we hope you take advantage of that and ask them any questions you have. And they're going to go over the importance of financial planning as you come into your retirement years. With that being said, give us a moment to set up for Q&A, and we'll be back in one moment. Okay, welcome back. Now we're going to start our live Q&A session. I have the panel back up with me. Thank you, Heather and Rena, for joining us. Great job on your presentations tonight.
Thank you.
We got a lot of great questions coming in. We did ask to keep the questions very general in nature. If you asked a personal question on here, we were going to flag it and make sure a staff member gets back to you tomorrow. So let's start the Q&A. Heather, I'm going to start with you. You talked about the importance of having a beneficiary on file. First question that comes in is, can I name more than one beneficiary?
So from the health fund standpoint, yes, you can. The health fund, you can name multiple primary or contingent beneficiaries. As far as the pension and annuity, that does automatically go to your spouse. So your spouse will be the primary beneficiary. However, you can name multiple contingents.
Okay. A follow-up to that is, what happens if I have no beneficiary card on file? That's a good question.
If you do not have a beneficiary card on file, please contact us so we can mail you one out. Also, if in the event we don't have one when you pass, we will revert back to the plan, which will go to your spouse, your children, and then there are other beneficiaries that we can leave that to.
Okay. Right now they're health and welfare heavy. Rena, we'll get to you in 1 second. What do I do when I sign up for Medicare, but my wife is still on the regular retirement benefits?
So if you are eligible for Medicare, make sure you do enroll. Send us a copy of your card. We will enroll you in our Blue Medicare Advantage plan, and your spouse will still remain on the active coverage, so the independence administrator benefit, until she or he goes on to Medicare as well.
Okay. Thank you for that. Now, Rena, I'm going to turn this over to you. I know that there is a reduction in disability benefits if I'm getting anything from the state of New Jersey. Is there any reduction in the fund disability benefits if I'm receiving Social Security? And is there an age requirement or limit? I guess that there's a lot in that question. So why don't you just kind of reiterate how you would qualify for disability pension?
So first, to qualify for disability pension, you do have to have a Social Security Disability Award onset date. Once we have that letter, you would have to send that to us. And then you would have to have 10 consecutive years of being active within that plan. So if this does qualify to you, call us here at the funds office. We'll go over any separate requirements on top of that. To piggyback on top of that, Social Security, if you are receiving Social Security, there is not going to be a reduction on your pension amount. So those are kind of two entirely separate accounts there. So no matter what you're getting for your pension amount, once you jump on Social Security, it's not going to affect that amount that you're receiving here from us.
Okay. Here's another question that came in. What happens to the benefits I earned under the VPP? I know you touched upon it.
Mhm.
Why don't you just kind of reiterate, because we got another question that came in regarding the VPP and how, as I mentioned, it goes away with the merger, but there's still a portion that will still get adjusted each year.
Correct. So for any former Philadelphia participants, this VPP started as of January 1st of 2023. Former New Jersey, January 1st of 2022 is when that started. Those contributions that you made up during that time are not going to go anywhere. You will continuously always have those contributions in there, and it will continuously earn interest on the plan's investments. Just starting January 1st, 2026, that's when we're jumping to the current pension plan. So it's just new. It's not like those contributions are going anywhere.
Okay. Thank you, Reno.
Mhm.
Heather, I'm going to turn this one over to you. I just went on Medicare. Is my network the same as it was before? I would hate having to find new doctors. So how would Medicare work with
Sure.
our plan?
So as long as your provider that you're seeing is willing and able to bill Medicare, you can still continue to see them. They will be in the network with Blue Medicare Advantage.
Okay.
So just check with them to make sure that they are able to bill Medicare.
All right. Here's a two-parter. So I'm going to hit you both with this one. Let me get it up here. It's a good question. If I get married, can I add my new spouse to my pension payments? So Reno, why don't you take that one?
So if you get married, as far as your pension payments, you can never change your retirement option once you retire, right? So once you retire, that is finalized. If you get remarried, I mean, as far as health benefit wise, you could jump on the health benefits, but as far as the pension options, that's final once you choose that at retirement.
Yeah, so there's no joint, so you can't change your joint survivor
Correct.
after you got remarried or something like that, as long as you elected it prior to retirement.
Correct.
Okay. And Heather, just want to answer if I get married in retirement, can my new spouse come on my coverage?
Yeah, absolutely. You just send us the required documents, marriage certificate, birth certificate, social security card, send them into us with a letter letting us know the effective date, and then we can definitely add them on.
Okay. Here's a good question. I have a little over 3 years before I can retire. When should I make an appointment to sit down with somebody at the fund office? So I'll kind of add to that. I think there's two parts to that. If somebody just wants an information
Mhm.
appointment, when do you think they should come in, Reno?
Which, first of all, the information appointment, very important. You can call us whenever you would like. We try to schedule those information appointment onlys the last 2 weeks of every month. So give us a call whenever you're ready. Give us a call a month prior. We'll schedule you Tuesday, Wednesday, or Thursday. We'll get you squeezed in. We'll go over all your pension information, all your annuity information, everything you have here, as far as how many health credits you have, how close you're getting to obtaining that retiree coverage. And then from there, as far as calling to make an appointment for your actual pension appointment, if you're a married participant and never divorced, call us 2 months prior. And if you are divorced with an actual qualified domestic relations order, call us a minimum of 4 months prior.
Okay. Thank you for that. That answered that question. I had a question here is, what year is the cutoff for receiving the double bubble pension? So this supplemental pension, maybe you explain the background on the supplemental pension.
Mhm.
And who's entitled to it, and then when it would stop.
So the double bubble is entitled to our former Philadelphia participants. If you were contributing to that legacy account on the Philly side, that double bubble, if you hit the requirements, and again, call us because there's a few different requirements that you need, so we can at least let you know personally how close you are to those requirements. You get that once you retire, leading all the way up to Social Security age. That goes away age 62, since that's the earliest age you can receive Social Security. We'll do it automatically here on the funds office side, so you don't have to contact us or let us know once you're turning 62. We'll just automatically take that supplement or double bubble pension payment off, and then you'll start receiving the rest of your pension amount after that.
Heather, I'm getting a lot of questions about silver and gold coverage and possibly a runoff period. So if you can just kind of bundle it together and explain how gold or silver coverage would qualify you for retiree medical coverage. All right.
Sure. So like I said in the presentation, for every silver benefit period that you have earned during your career, you receive a quarter of a credit. For every gold benefit period you have acquired, you receive a half a credit. During that plan year, you will receive a maximum of 1 credit. So once all those add up to 30 credits, you will be eligible for retiree health care. Now, we don't have gold or silver retiree health care. So if you qualify for healthcare, you will receive the gold benefits, which is the exact same benefits as you currently have now if you are eligible for gold once you retire.
Okay. And is there a way for them to find out how many credits they have towards retiree healthcare coverage?
So yeah, so they should contact the pension department of the fund
Mhm.
office. They'll be able to verify how many credits you have.
We're getting a lot of questions about retiree medical coverage and about broken years and unbroken years and such. I think the best option would be then for the call the fund office, and we can send them a printout of where they are right now from a credit standpoint on the retiree healthcare coverage. Okay. Give me a minute here. Are New Jersey participants still eligible for the rule of 85?
Yes, that is going to only affect your, those pre-merger accrual rates. So the amount of rates, I think it's prior to 2022. That's only going to affect those rates. And again, that's your age and years of service. That adds up to 85. Then again, that reduction doesn't take place.
Okay. Reno, another one for you. How do I know if I had a past break in service?
So to know if you have a past break in service, that would be in an actual pension statement that we have. Give us a call. That way we can specifically look into that. It's not available to actually see on the fund's website. So give us a call. We'll look into that and see if you have a break in service anywhere along there. We can also let you know how many pension credits and health credits you're currently at.
Okay. We're getting a question here. I'm 57 years old, but only have 28 years of vested or 28 credited years of service, I believe is what he's trying to say. Can I retire now without any penalties?
You can retire, but there would be that reduction. You want to either hit 30 pension credits, you would get that full pension accrual rate, or wait till age 62 with 25 years, and you get it unreduced.
Okay. I got a question here, Heather. What is the cost of COBRA for a spouse right now? Do you know that?
So for a surviving spouse that is Medicare eligible, the current premium for this time frame is $389.53. That can change year to year. In the event you were to pass and your spouse is not on Medicare, for a single person for the gold level is $860 a month.
Okay. Thank you. That's a lot of more COBRA questions coming in. Hopefully we just answered them. Give me 1 minute here. Here we go. Reno, it's going to you. If I wait until 62 to retire, do I lose my double pension?
Yes, because that's at that minimum age of receiving Social Security. Once age 62 hits, you can no longer get that double bubble or supplement pension.
Okay. Heather, this one's for you. Got a member I am 66 soon and will be 66, still working full time. Must I sign up for Medicare now or when I truly retire?
So if you are actively working and about to hit 65 and you're looking into all that, no. Once you actually stop working and you're no longer have active employer coverage or be covered by a spouse who's actively working, you can defer Medicare Part B until you stop working or your spouse stops working. The active coverage allows you to defer Medicare until you decide you don't want to work anymore. So you can postpone that.
Okay. Thank you, Heather.
Mm-hmm.
Here's another good one. For the pension information appointment, can we have a financial advisor attend with us?
Oh, 100%. If you want a financial advisor to sit in with you, that's actually probably smarter than not, because I think kind of help you, show you what payment options you have. If you do not have a financial advisor come in, but you want them to look at that information, we'll make a copy of all the information you look at in the appointment, because then you can take that information to them You can kind of show that to them and they can kind of steer you in the right direction from there.
Okay, thank you, Reno. Here's another one. Would I be able to get a monthly withdrawal from my annuity after retirement? So it's going to go to Reno.
After retirement, so let's say you leave the full amount here, you don't make a decision at retirement, and then you come in and you're like, all right, I want to make an option on this. You can make that into the equal payment amount. So that's completely fine. If let's say you do choose it at retirement and then you want to change the amount that you're getting, you can actually only change that amount for 2 months. 1 month is January, the next month is July. So if you do choose that option, make sure you know which one you want to choose and you're completely confident in that one, because you can only change it twice.
Okay, thank you, Reno.
Mm-hmm.
Next one is going to be to Heather. I think I clicked too quickly, so I will regroup here. But Heather, the question is, I am turning 65 in April. I just signed up for Medicare A and B. Do I also need to choose D for prescriptions, or is it just A and B?
You just need to enroll in Parts A and Part B. If you're no longer actively working or have active employer coverage somewhere else, you enroll in Parts A and Part B. We will give you the prescription, which is the Part D plan, through us here at the fund office.
Okay. We are getting a lot of questions about, will this presentation be available to the membership? Yes. As I mentioned, we're going to be rolling out information on phase 2 and a sign up for phase 2. We will be attaching a copy of phase 1, a link so you can rewatch this if needed. So just wanted to get in front of that. So I answered that question. We are getting a lot of personal questions about age and years of service. We will have somebody reach out to you regarding that. All right. That's all the questions that have come in. I believe I answered them. If I did not answer your questions, it's because they were a little bit more personal in nature. And again, we have flagged them and we will have a staff member reach out to you directly to answer that. With that being said, I just want to thank the panel. Great job tonight on your presentations and your answers. Thank you for attending, everyone, and make sure you sign up for phase 2. We'll do it again next week, and have a good night.